All right, my name is Peyton Cadwell. I'll now be doing my musculoskeletal assessment on Tyler here. So my assessment will begin assessing his shoulders and iliac crest. I'm assessing the alignment, and he appears to be perfectly in line. His body is symmetrical. No obvious deformities are noted. I'm now going to assess his cervical, thoracic, and lumbar spine. And they, all of which demonstrates appropriate curvature. Tyler, I'm now going to have you bend over and just let your arms hang there. I'm going to assess his spine, looking for any abnormalities such as scoliosis, none of which are present. His spine is straight and midline in his body, as expected. So now I'm going to put some gloves on really quickly, and I'm going to be palpating and assessing the range of motion of your TMJ. So what I'm gonna have you do, Tyler, is just open and close your mouth.
Okay.
And move your jaw side to side. Excellent. So patient demonstrates good strength and range of motion with his TMJ. Tyler, now I'm going to assess your range of motion of your cervical spine and then your spine. So if you can look both ways, up and down, roll your head around, perfect. Demonstrates appropriate range of motion of a cervical spine. Now if you could do the same with your entire torso,
okay,
side to side, kind of bend over, bend backwards. Excellent. So patient demonstrates adequate range of motion of TMJ, cervical, and spine. Now I'm going to assess your sternocleidomastoid and trapezius strength.
Okay.
So first what I'm going to do is I'm going to put my hands right here. If you can shrug your shoulders.
Okay.
Okay, one more time. Good deal. Now push your hand against my hand.
Okay.
Same here. Patient demonstrates 5 out of 5 strength with both his sternocleidomastoid and trapezius muscles. Now going to assess his upper extremities. First, what I'm going to do is inspect and palpate his fingers, hands, wrists, elbows, and shoulders for any tenderness, crepitus, or swelling. So, patient's skin is warm. No obvious swelling abnormalities, any pain or tenderness as I'm palpating. Okay, none in the right extremity. Any tenderness here. So patient, no tenderness, pain upon palpating his upper extremities. Skin is warm, dry, and tacked. Patient's muscle tone of his upper extremities appear to be normal for his age and gender. So now I'm going to assess your range of motion of all those things. Okay. So if you can kind of open and close your hands, roll your wrist around like this, move your arms up and down, and then, yes, perfect. So patient demonstrates adequate range of motion of his fingers, hands, wrists, arms, and shoulders. Now going to assess strength of those. So what I'm going to start by having you do is just squeeze both my hands.
Okay.
Excellent. Try and open your hands. I'm going to try and resist. Okay, great. Okay. Now if you can, I'm going to give you some resistance. If you can try and pull up. Okay. Excellent. And if you can try and push down. Good deal. Push against me. Okay. Pull back. Okay. Awesome. And now I'm going to have you put your arms out to the side. Okay. Don't let me push them down. Okay. Good deal. Don't let me push them up. Okay. Awesome. So patient demonstrates 5 out of 5 strength bilaterally on all of his upper extremity strength exams. Now going to move to his lower extremities now. Again, going to begin with just inspection and palpation of his feet and ankles. Any tenderness as I feel here, begin knees and hips as well. Any tenderness noted, Tyler? Okay, I'm going to do the same for your left. Begin with toes, feet, ankles, and hips. Any pain or tenderness there? Nope. So patient's skin, same as upper extremities, it is warm and dry. No obvious abnormalities noted. Patient does not demonstrate any tenderness or crepitus on his lower extremities. And now going to assess your range of motion. So if you can roll, just perfect, yeah, roll your legs around. Okay. If you can bend your legs up and down like that, that's perfect. Good deal. So patient demonstrates adequate range of motion. I'm now going to assess your strength. So first thing I'm going to do here is I'm going to have you push against my hands like a gas pedal. Okay. Great, now pull them back towards you. Okay. Okay, now don't let me push your legs down. Okay. Okay, excellent. Now don't let me bring them up. Okay, awesome. So patient demonstrates adequate 5 out of 5 strength as well as great range of motion of his lower extremities as well. His muscle tone is also normal for his age and gender. And I believe that concludes my musculoskeletal assessment.